Today we're going to talk about clinical breast exams. As a radiologist, I spend a lot of time talking about mammography, but clinical breast exams are an equally important part of the breast health equation. So what is a clinical breast exam? A clinical breast exam means a physical examination of your breasts, how they feel and how they look, by your healthcare practitioner. So what they'll do, they'll have you lay on your back usually, and they'll examine your breast, usually with your arm above your head so that your breast is flattened, and they'll be looking for any areas that feel thickened, lumpy, or bumpy, or different from one side to the other. They'll also do a careful evaluation of the armpit area for a couple of reasons, because sometimes breast tissue actually goes up into the armpit, and also because they want to look for lymph nodes there. This is a really good time while your clinical practitioner is examining your breast to ask questions about your own breast self-exam to make sure you know the technique and to make sure you're doing it properly. Oftentimes they'll have little models having little bumps inside that tell you, kind of let you know what it is you're feeling for. They'll also have you sit up because looking for changes in your breast as you sit up is an important part of looking for breast cancer, looking at the nipple and looking for any changes there. So the clinical breast exam is the main way we have of looking for breast cancer, of screening for breast cancer in young women. So we recommend age of 19 or 20, start getting your clinical breast exam. Have it done every time you go in for your regular physical checkup, but at least every 3 years from the age of 20 on. Then when you reach the age of 40 and you start having mammograms, it's still important to keep having that clinical breast exam. We recommend that you have it every year just like you do your screening mammogram. And the reason for that, there are several reasons. One of the reasons is mammograms are not perfect. They will not pick up every breast cancer. About 15% of breast cancers, for lots of different reasons, will not show up on a mammogram. So the clinical breast exam is a second line, another way of screening for breast cancer. Remember, even though it might be scary, if you find something, or if your doctor finds something doing that clinical breast exam, it's still likely to be either normal tissue or a benign finding. But again, if they do find something, they'll send you for further imaging usually. So the clinical breast exam, a very important part of breast health. So make sure you have a careful breast exam every year.